Welcome back for part 2 of today's segment. This is going to be covering heat-related illnesses and cold-related illnesses or emergencies. So what we've seen lately is the winter season's about over. We're getting into those spring and summertime days. In Illinois, it's very bipolar. We get the best of both worlds. We get the extreme heat with humidity. We get the extreme cold and wind chill all at the same time. So we have to be aware of all these possibilities. Come on, Carhart, knock it off. They're just playing a little rain bugs, just I gotta take them outside here. So when we're done, we're done. Let's see here. So introduction, okay? The body is equipped to withstand extremes in body temperature, okay? However, when the body is overwhelmed, a heat-related illness or cold-related emergency can occur. And this can happen from people being indoors or outdoors, actually. You know, sometimes you can be in a very hot room environment. Sometimes you can be outside in the very cold, vice versa. Signals, though, they're progressive and they can become very much life-threatening over time, and they can be actually pretty quick, so we have to be able to observe and see when these problems are arising. The first off, with the brain, okay? The brain has a structure called the hypothalamus. It's deep within our brain, more centrally and lower located. But this is what controls our body temperature. So when the body becomes too hot, the hypothalamus tells the blood vessels to start to constrict near the surface of the skin. Okay, so when we're cold, we constrict the surface of the skin. You see goosebumps sometimes, right? Tight skin. Warm blood stays near the center of the body to keep the organs warm, right? And if this doesn't work, then the body starts to shiver, right? We're creating involuntary muscle contractions to create heat in the human body. Okay, in warm weather or hot environments, the opposite is going to occur. The blood vessels at the surface of the skin are going to start to dilate to expel more heat, and we're going to start to sweat then. Sweating is hopefully going to allow that perspiration to evaporate from our skin, which will take heat with it to cool us down. There's 5 ways we can cool the body, okay? That can be through radiation, convection, conduction, evaporation, as well as respiration. So those first two, right? Last two, evaporation and respiration, that's something we can do naturally on our own. We can feel heat radiated from somebody's body. Just put your hand near them, you can feel that heat, right? Without even touching them. So we can actually cool somebody by having them in a cool, arid environment, right? That's going to help them radiate that heat off their body and cool their body. Conduction, right? That's rubbing. When your skin rubs against something, it becomes hot, right? So if we rub against maybe a piece of ice, that'll cool us down, but that can cause pain or frostbite to somebody, so we wouldn't want to do that, right? Let's get into the major factors, though, for body temperature regulation. The main factors are going to be air temperature, they're going to be humidity, as well as wind. Other factors are going to be things like how much clothing the person is wearing, the type of clothing they're wearing, the amount of breaks they take from the exposure. Their amount of water intake is very big, so their hydration status. And then the intensity sometimes of their activity will be a factor. These individuals that would be at higher risk are going to be people that are working strenuously or exercising strenuously outdoors in these environments. Also, people that have pre-existing medical conditions. So how all of you know, I have skin burns or skin grafts, I should say, where I don't sweat from certain parts of my body because I've been stripped of all my sweat glands and hair follicles. I'm somebody who is at higher risk of these heat-related illnesses then because of that, since I do not cool my body temperature down as much. So pre-existing medical conditions. Use of diuretics. So anytime you're flushing the body of excess water, you're dehydrated. Now you can't regulate your body temperature as well. Somebody who is maybe just dehydrated in general, that can also cause these risks more often. If you've had previous heat-related illnesses or cold-related emergencies, that's always a sign that this could be at risk, right? Somebody who's already been through these experiences before are more likely to have them again. If you wear inappropriate clothing in the weather that you're in, and of course for the elderly and the young. The young cannot emit as much heat as us. First off, as a human, right, our respiratory rate's going to be lower, our blood pressure is going to be lower, our heart rate's going to be lower than these children. So we're going to dissipate heat easier. Our bodies are also bigger, so we have more surface area to dissipate heat compared to a child. So if you ever notice a child playing in the heat, they are running around, they are not sweating, and then all of a sudden they're just sweating profusely. It's because it takes longer for their body to get to that point. But once they're at that point, they sweat a lot more than us. So we have to be very much aware that we need to give them more breaks, keep them out of the exposure of the heat as much, get them more hydration too, because they don't drink water as much as us too. The main thing is these things can go from being a very short period of time bad to a very, very bad time out of nowhere. The first step, right, when we're looking at heat especially, or cold, but mainly heat, is their hydration status. If you are dehydrated, you're going to feel thirsty. If you are thirsty at all, you are technically dehydrated already. So people that have inadequate water intakes or fluid intakes, people that are vomiting, having diarrhea, people that have certain medications will cause them to get dehydrated. People that have a lot of alcohol or caffeine in their system, this can cause dehydration. So this is the first step to causing more likely a heat-related illness. You can monitor your urine color. That's the big thing. So you can now tell if you're dehydrated by your urine. If it is clear, awesome, you're doing good. If it is yellowish to more of like an amber color, amber is always bad. That means you are severely dehydrated. You need water immediately. Don't chug water, right? Drink cool sips of water slowly over time. 5 to 10 minute period of time of sipping, maybe 12 to 20 ounces. Our initial signals, though, for dehydration are fatigue, their weakness, headaches, irritability, nausea, dizziness, of course, excessive thirst, and then maybe just having dry lips and a dry mouth in general. Now, these things can get worse very quickly. From those symptoms, we can get to having a loss of appetite completely. They are severely thirsty. They are severely dry mucous membranes where they're like trying to clear their throat and it's very dry. Their eyes, right? Their eyes could be sunken in a little bit. We can see this with babies. Since they can't tell us they're dehydrated, we can see if their face is a little sunken in. Dry tenting is another thing that we look at with the skin. Dry tenting means you squeeze the skin and it stays stuck up a little bit. That means the person is severely dehydrated. We need to get them water very quickly. Little sips, of course, slowly over time. Again, with children, since they can't always tell us what's going on, we look for the tenting of the skin, the sunken in eyes. We also then look for their appetite being down, as well as their urine output, right? If we check their diaper and it's more of an amber colored urine, sign of dehydration. If anybody is unconscious from dehydration, worst case scenario, we call 911 immediately. Basic care though, right? I just said it, small sips of cool water. You can use sports drinks as well, like Gatorade or Powerade, Pedialyte. These are absolutely fine to be used. But again, slow pace, small sips, not gulps. That's why a sippy cup is so good for a kid. They can just sip small amounts. For severe dehydration, again, very dark colored amber, unconscious, we call 911 immediately. We don't mess around. They're going to hook them up to an IV where they do some saline solution, monitor their health for hours till they're back to normal. Heat cramps are the next stage. So we had dehydration, now we have heat cramps as the second step. Heat cramps are, again, from severe heat-related illnesses. These include painful muscle spasms, usually in the abs, abdominal muscles, or the legs. Sometimes they can be in the forearms, but more oftentimes the legs because they're more distal, further away from the center of the body. We can also see usually a normal body temperature, and the skin is usually moist because the person's been sweating already. Now this can go from being just heat cramps to much worse stages pretty quickly. The main thing is though, if we notice the heat cramps, we start sipping on water, rest the person in a cooler place, right? And do some light stretching of the muscles, maybe a massage to the muscles. We don't give anybody salt tablets. Again, the sports drink or water should be sufficient enough along with resting from activity, right? Once the cramps have stopped completely, that's a time where somebody can get back to activity. So maybe they're playing a basketball game or something like that. Still, monitor your level of hydration. We go from heat cramps to heat exhaustion pretty quickly. So heat exhaustion is the third step. These are much more severe than the cramps. This is when there's a result when fluid is lost through perspiration and is not replaced by other fluids. The common signals of these are a cool, moist, or pale, even ashen, flushed skin. They could be very weak. They could be dizzy. They could be breathing very shallow, completely exhausted. Come here, I got you. He's a little rambunctious today, little Carhartt. Now he's on video, and now he's shy. Heavy sweating though, decreasing level of consciousness, we could have headaches, nausea, we could even have muscle cramps going on. So our basic care for heat exhaustion is going to be to move the person to a more cooler environment. Maybe put a circulating air fan on just to cool them down. But we want to loosen up any clothing that they have that's restricting maybe their breathing. Maybe they're wearing a necktie, right? We can take that off, unbutton their shirt. We can fan them down. We don't want them to fan themselves down because they produce more heat that way. So you can fan them down yourself. You can spray them maybe with wet cloth or with water with a spray bottle, right? While you're fanning them, and you can also maybe even put a wet cloth on the back of their neck, on their forehead. These seem to help cool the body down in the first place. If the person is conscious, have them sip on water or small sips of a cool fluid. Keep them resting in the most comfortable position, right? And then watch their changes carefully, because this can be very quick from one direction to another. And of course, we do not allow the person to resume normal activities the same day. They need to rest for heat exhaustion. Now, worst cases, we call 911, because heat exhaustion, if we don't have water, don't have access to somewhere cool for them, we think their situation is getting worse, we call 911. Okay? If the person vomits, we call 911 as well. We stop giving them fluids if they're vomiting, of course, right? If somebody's unconscious or vomiting, of course we don't give them fluid. We call 911. We can rest them in the Haynes recovery position that's on their side, right? Watch for breathing problems, because they could stop breathing possibly. We might have to give CPR. But what we can continuously do is try to cool their body. Heat exhaustion gets to the worst level pretty quickly. We go from heat exhaustion to heat stroke. Heat stroke is the most severe, life-threatening illness. This is when the body systems become so overwhelmed by heat that they stop functioning altogether. The body stops sweating. So if we stop sweating, the surface of the skin gets very dry, very, very hot. The body temperature will rise quickly from that, and then the brain and vital organs will begin to fail. They will shut down. Hopefully we've called 911 before this happens. But again, you see dry skin, and they're unconscious, and they're hot, heat stroke most likely. Call 911. This can be classic from just being outside to exertional, where somebody's doing extreme activity even too. These are the signals. First and foremost, like we said, extreme body temperature, flushed or red skin. It could be dry. It could be moist at the start because they just went from heat exhaustion to heat stroke, right? So in heat exhaustion, their skin might feel very cool, but then all of a sudden, for heat stroke, they stop sweating and now it just feels hot. For instance, a very humid environment, the sweat is never going to evaporate. So they could have sweat on their body, but they are burning hot. It's not evaporating. Heat stroke. Body temperature is usually 104 degrees or higher with that. 104 is very, very dangerous. They could be breathing very rapid, shallow breaths. A throbbing headache could be going on. They could be very confused. They could be coming in and out of consciousness, or even having seizures. The main thing, like I said, call 911 immediately and cool the person. For heat stroke, we're going to immerse the person up to the neck in cold water. Okay? We need to cool down their entire core body temperature. We don't put their head under, right? Because they need to still breathe. But we can cover the person's entire body, if we don't have a bath like that, with cool ice water soaked towels. That would be sufficient enough. We could spray the person with cold water, spray them with a hose, I guess you could say, or just fan the person. But again, if we can submerge the person's body up to their neck in cool water, best case scenario, and then check their body temperature with a thermometer. You want to do this for about, I'd say 20 minutes or until the condition improves. So continually monitor the person, never leave them alone when you put them in a bathtub like this. They could go unconscious. You can give other care for other conditions found, and then also be prepared, right? With heat stroke, organ systems can shut down. You might have to pull that person out of the bathtub or lay them on a firm, flat surface to give CPR if they stop breathing or circulating blood. Enough with heat. Let's go back into the cold stuff that we probably are done with for the season. And the first one would be frostbite. Frostbite occurs when the body part is exposed to cold, and it actually freezes the body part to where there's no circulation and the tissue dies. The other portion of cold-related illnesses is hypothermia. Hypothermia is when the body can no longer generate sufficient heat to maintain normal body temperature, and organ systems also fail. In your book, there's a great picture of somebody's foot. where it's been severely frostbitten from the heel and the top of the foot to all the toes, the skin will turn black because there's no blood supply. The tissue dies. This tissue has to be removed. There's no chance to save it. But for more minor forms of frostbite, we can do a lot of help. But these are the signals, okay? The signals of frostbite are that there is a lack of feeling in the affected area. There is severe swelling. The skin can appear waxy, it's discolored, and blisters can be forming at the affected area that's also turning black. Our basic care, number one, is to remove the person from the cold. Get them to a warmer environment. Handle the area very gently. So if it's somebody's hands or feet, we never want to rub the skin. That's going to be the most painful, traumatic thing we can ever do. You could rip the skin off the person's body. If we're going to attempt to rewarm the body part, we're going to want to use skin-to-skin contact. We'd want to softly hold the person's hand with our hands to warm up those fingers if possible. Okay. We don't want to ever try to rewarm tissue if we fear that it could get refrozen. So if you're in a cold environment and it's still going to be cold where you're trying to get that person, you're trying to warm it up in the first place and it gets cold again, we never want to have that happen. If we're going to maintain warmth to the person, we have to contact that skin constantly in that cold environment. So if it's you, right, and one person, not as easy. If it's you and other people, right, one person can drive you while you maintain that contact on that person's skin, keeping them warm at the same time. Just kind of like a scenario, you could say. If we have access, right, we can get warm water. That's the best thing we can ever do. And check the temperature of the water, because we want the temperature to be between 100 to 105 degrees Fahrenheit. Anything warmer than that is going to cause extreme pain to the person. The sensation is going to be ridiculously hurtful. Okay, so just think about that. You want to be just slightly warmer than normal. 100 to 105 degrees, that's slightly above human body temperature that it runs at. Once the tissue's been rewarmed, we can dry that tissue and then cover it with loose sterile bandagings. We can also put maybe bandages between the toes if each individual toe is affected to keep them from rubbing against each other. And we would never want to break any blisters. At all costs, never break a blister. We want to prevent hypothermia, so we're going to keep them warm from head to toe and check their core temperature from time to time. Hypothermia will definitely occur, oftentimes with frostbite, but usually if the body temperature just in general drops below 95 degrees Fahrenheit. That means the hypothalamus is going to shut down and the organ systems will fail. The body will stop shivering to stay warm, right? All these little things will stop and the body will freeze. Some factors that can cause this, first off, are right, cold and wet environments, wind, the age of a person, whether they're very young or very old, maybe somebody's current medical condition. So like me, right, with my skin grafts, I can be more susceptible to cold-related illnesses too, because my skin is very thin. It's not as sensitive to the feelings. Somebody who is drinking too much alcohol, somebody who is overdosed on drugs or poisoning, these can also affect hypothermia a lot more. Our basic signals, first off, as we said before, was shivering. It may be absent in the later stages when the brain is completely shutting down, so we cannot just take that as the number one reason why somebody could be in hypothermia. But we have to look at general numbness of a tissue or body. Maybe they have a glassy stare, they could have very impaired judgment, they seem very weak, decreased level of consciousness, as I said, and they're completely just unresponsive, all reasons to be considered hypothermia. What we can do is call 911, right? Immediately call 911 for any suspected hypothermic reaction. We can move the person to a warmer environment if it's safe to do so, and then we just give general care. So we check for breathing, perform CPR if necessary. We go ahead and remove any wet clothing the person has on. That's always the very first thing we do, is remove wet clothing, because again, that cool clothing against the skin is going to make you feel even colder. We can warm the body gradually by wrapping in blankets and plastic sheetings. But again, if we can submerge that tissue in 100 to 105 degree Fahrenheit water, that's the best case scenario to slowly rewarm the body. Again, that conduction aspect, the water against the skin. Other things we can do to help prevent hypothermia: wear a hat at all times when we're outside, wear a jacket when we're outside. A lot of times little kids will take these things off when they've been playing outside, and then all of a sudden they have a cold sweat going on. They're just asking to catch pneumonia or something like that. Okay, Make sure you stay adequately covered is very key in the first place before anything has ever arise. Moving forward though, if far from medical care, you can position the person near a heat source or apply maybe like a heat pad or other heat sources to the body, but again, not too hot. Other things that we can also do, if the person's alert and they can swallow, we can give them warm tea, warm coffee, a warm fluid to drink, just again, small sips. Things we do not do, rewarm too quickly. Rub the area, massage the area. We never do that, right? But we always want to monitor their condition. Other things we can do for general prevention of these aspects, whether it's heat or cold, okay? We can avoid outdoors in the hottest parts of the day and also the coldest parts of the day. We can dress appropriately for the environment and activity, so more layers if it's cold, less layers if it's hot. We can change activity level based on temperature as well, so we can take more breaks. We can drink large amounts of non-alcoholic or decaffeinated fluids, and then we can also then just generally look at the weather report before you go out and do those things, just so you know you're not putting yourself into a dangerous position. I have one question to ask you guys, and this is going to be your assignment, okay? I'm going to read a scenario here, and I want you to reply back to the scenario in the best case possible, and I'll review that next week once we have all the replies in with the next video. Here it is. 21-year-old Todd Wilson is doing construction work for his uncle this summer. Todd is putting fiberglass insulation in an attic. He is wearing long pants, a long sleeve t-shirt, goggles, a face mask, and a hat to protect himself from contacting the fiberglass. The outside temperatures have been running about 95 degrees Fahrenheit, and this day is also exceptionally humid. Todd had hoped to have finished this job the evening before, but he has returned to the job site around noon the next day. He expects that it will take him about 5 hours to complete the work. Because Todd is in a hurry, he is working very quick to finish the job. He figures he can save some time if he does not take a break. About 2 hours later into work, so about 2 o'clock, he's drenched with sweat. Todd starts to feel dizzy, weak, and nauseous. He barely has the energy to get down from the attic. If you were his uncle and you saw him come down from the attic that way, tell me exactly what you would do, being that you are first aid, CPR, AED certified. You need to help him out, right? What do you do? Write me down from start to finish your exact recommendations on how to combat his problem that he's dealing with this heat-related, humidity-related illness. All right. Thank you so much this week. Next week, we will jump into water-related illnesses or emergencies, along with pediatric and older adult and special situations as well. Thank you so much for bearing with me, and I expect this reply back to me by Thursday this week and no later. Again, today's date is 4/21/2020. Thank you again. Have a good week.